We're starting today with coronavirus again and Christmas. The Prime Minister, Boris Johnson, resisting demands to cancel Christmas, claiming it's too late to change these plans. But sterner warnings about the dangers of mixing over Christmas are to be issued by the 4 UK nations. Later today, the Prime Minister will face MPs in the Commons to declare his opposition to dropping plans for 3 households to be able to meet up from the 23rd to the 27th of December when restrictions are lifted.
Well, you can't do right for doing wrong. So many of you confused about this, so many of you have views on this, though increasingly over the week, I think it's sort of like 2 out of 3 people are sort of saying now, right, we understand the seriousness of all of this, not sure we should go ahead with the plans that we have. But other people feel very, very strongly that, you know, you've told us we can do it, so we're going to do it. The editor of the British Medical Journal is Fiona Godlee, and Professor of Medicine Paul Hunter join us here as well. Fiona, what is the BMJ's stance on this?
Well, Eamonn, I think everyone would love to meet up for Christmas, but sadly the data on the rates of COVID infection and the rates of numbers of people going into hospital seriously ill with COVID are going up all across the country. And the projections suggest that that's going to get worse anyway if we add in the Christmas relaxation and then we add in the normal winter pressures of January and February. The NHS is going to really struggle. It's struggling already. And struggling for the NHS means that people won't get the care they need, whether that's for COVID or for non-COVID. So anything we can do at this point to prevent people getting infected and getting ill is going to be terribly important. And one of those things would be to avoid the kind of extensive relaxation for those 5 days of Christmas that the government has.
You see, Doctor, it's very interesting listening to you there, because there is what the science tells you, and you're going to be ruled by science. Politicians want to be popular by and large, and I think we want to be led. The Mirror, I just think, has the perfect headline today. All we want is a decision. Can we? Can't we? You could also say there is a science about mental health, Doctor, and the effects on that may be more hidden than the COVID thing. But when you look at the balance, as a scientist, what would you say?
Well, the mental health side is absolutely crucial as well, and the problems of people who are losing their jobs or businesses going bust, and loneliness is a real issue. So we have to acknowledge all of that, but the sort of brute fact of it is that we have a health service that's under stretch. It's been underinvested in for many years. You know, it's important to say that. We've had public health measures that haven't been as good as they should be across the whole of this pandemic. Test and trace and isolate not functioning nearly as well as it should do. So the whole host of other things that have led up to this. And you know, we're not going to get our economy and our social society back unless we get the virus under control. I think we have to see that those two things aren't separate. They're all part of the same thing.
Professor Paul Hunter, I mean, people were delighted when we were told, that there's going to be this bubble between the 23rd and the 27th of December. Please act responsibly as you can, but you can get together with your families. Do you think people need to rethink those plans, or do you think they can go ahead safely?
I think the science is actually not that clear on either side of the argument. Certainly, meeting up in people's homes over Christmas will increase the risk of transmission. But when you look at what's been really driving the epidemic, schools, hospitality venues, large gatherings outside of the home, these will probably not be well, almost certainly won't be happening during that same period. So that although there is a risk, and inevitably we will see some increased transmission in people's homes, it won't necessarily be that obvious in the grand scheme of things, because all these other activities where the disease is transmitted will be reduced. And I think, if we are going to meet up over Christmas, and I think it's right that we are allowed to do so, and I think the Prime Minister's decision is correct, but there are big provisos to that. And the first is, if you are symptomatic, if you live with somebody who's got COVID or has been tested for COVID positive, if you have been told to self-isolate, Christmas is not a reason why you can ignore that advice. The risk of transmission in people's homes is real, but it has been overstated by many people. Earlier this week, I was on a programme where it was said that, you know, if you go into a house with somebody who's infected with COVID, you're almost certainly going to get it, which is absolutely not true. The secondary attack rate in homes is about 20%, so about 1 in 5 chance if you live with somebody. That drops to about 1 in 8 if you live with somebody for less than 5 days, and it drops probably to about 1 in 20 if you are asymptomatic. So
sorry,
there is
Professor
a risk.
Hunter, I was going
It's
to
not
say
as
that,
great
because
as it has been
isn't the,
suggested, though.
sorry, Professor, to interrupt you, but isn't the concern, obviously, if you had symptoms, we would assume that most responsible people wouldn't go anywhere near family members, particularly vulnerable family members. Isn't the problem that you could have coronavirus and be asymptomatic, so you could take that into a loved one's home without knowing it?
Well, that is indeed a risk. But if you are asymptomatic, you're much less likely to transmit the infection than if you are symptomatic. Asymptomatic people probably about a third as likely to transmit the infection as people who are symptomatic. And this was published in a report by Imperial, I think by Dr. Thompson a few weeks back. So yes, there is a risk, but it isn't as great as it has been suggested by a number of commentators. So, if you can get by without going to meet people at Christmas, fine. But it is a big issue for many people. People who are vulnerable, maybe people this is their last Christmas, would rather take the risk than
yeah, and it all gets very emotional, and we understand that. Thank you, Professor. I just want to ask Dr. Godlee there as well, because you're representing so many medics, of course, in all of this. And Professor Hunter, I mean, he's talking there as well about the emotional side of all of this, and, you know, people who just want to be with family and they think it may be their last Christmas together. They need to be. You understand that. You get all that. I see. But what we're going down, we're going down, the way Professor Hunter is describing it is like the way the government are describing it. They're going to scare the bejesus out of all of us in the hope that we will be responsible. But they're not going to actually tell us to do anything different, are they?
I think anything that can be done to give people a sense of real caution, I think that will be an enormous help, and sensible people would already be doing that. I think that the risk of sort of travelling up, you know, across the country and spending 5 days with you know, three big family groups, that is obviously going to be a dangerous thing to do. So the more we can do to stress that. Preferably the
but you know, Dr. Godlee, in your position as well, I'm sure you would love to show people videos or hold a mirror up to them and say, look, here are the medical staff I speak for. This is what they're going through now. Could you actually describe to people, if we are irresponsible, what the new year has in store for those medics?
Well, I mean, I am getting a lot of messages from medics saying, you know, this is so important. Please put this message out. We're exhausted. We're overstretched. We can't give the care we want to, not only to people with COVID, but people with other conditions. You know, we've got this Christmas relaxation. They're very frightened about what will happen. They're frightened about what January will bring. We see the intensive care units are full. And the other hospital beds are pretty much stretched as well. The staff are tired. They've had 9 months of some of the most difficult professional months of their lives. So, you know, they really don't want people to get infected if you can possibly avoid it. Government action would be helpful, but I do understand that people are longing to meet up for Christmas. It's just we've got to do it really sensibly, outdoors if at all possible, small groups, not for long periods of time, not over a large big meal. Singing carols, you know, we need to really be careful.
Well, really be careful, and stay safe, you two. Thank you very much indeed for your contributions this morning, Dr. Fiona Godlee. She's Editor-in-Chief of the British Medical Journal, and Professor Paul Hunter there as well, Professor of Medicine at the University of East Anglia.
So many people wrestling with this, aren't they, this decision?
We're all wrestling with it.
Everybody's wrestling with it. And
I have made the decision I will not travel to Ireland to see my 92-year-old mother. I I think she would prefer if I came, but I just couldn't. I mean, you go through an airport, you know, there's too much. It's too much of a risk. And
then,
we've
you
got
know,
the vaccine just around the corner.
Well, that's the thing. It's that light, isn't it? It's that light. It's like, do we want to risk that? But some people are saying if they do it responsibly, care for the people who are vulnerable, be safe and socially distanced, that they can do it. So it is a very, very difficult one. And I think we'll be hearing a lot more about it, actually, later today.
John Lennon's song, isn't it? So this is Christmas, and what have we done?
What have we done?
I hope we don't do the wrong thing.
I hope
That's for
not.
sure.